Okay, I have noon on my clock here. We're still getting people logging in. I can see them popping in here one after another. We got, as I mentioned earlier, about 317 people at last count that were scheduled to attend. We'll see who all will get logged in, but appreciate all of you who are attending so far. We're going to go ahead and get started here. So let's see here. So a little bit about the Contouring Challenge just to start off. Our sponsors are the AAMD. We were very, very pleased that the AAMD came on board back when we were doing our first Contouring Challenge. They saw the merits of this and said that they would definitely want to be part of it, which was very exciting for us. Radiation Oncology Resources, who will be actually presenting today. Greg Robinson from ROR will be presenting today. Standard Imaging, of course, this is Neil Miller. That's the company that I work for. And Canis Lupus LLC, which is Ben Nelm's company. Ben was basically the developer behind our structure software, and that is really the key to everything that we're kind of going to be talking about today. So what we're going to be doing today is I'm going to go through an introduction to the Contouring Challenge and why we feel a contouring quality system is needed. And then John Ruski from Loyola University is going to be talking about a clinical quality assurance system that they've put into place in their clinic for their dosimetrists. Some really interesting things there. Greg Robinson from ROR is going to be talking about how contouring training can actually create some great results. And then just a quick, I guess, substitution here. Dr. Leone, who did our gold contouring for this challenge, was not available today. And so I'm very, very pleased to have Dr. James Wheeler from the Center for Cancer Care in Goshen, Indiana, who was very kind enough to step in. He will be talking about actually some new information that just came out at the RSNA show about brachial plexus contouring, which is, I think, very applicable to what we have here. And he'll be talking a little bit about the golds, too, and will be available to answer some questions about the gold contouring, if there are any. And then Ben is going to step in and talk about the experimental design of, how the Contouring Challenge kind of worked, the methods that we use. We have down here, he's going to do structure QA demonstration. Actually, I'm going to do that in my little intro here, so he's probably not going to have to do that when he gets into his presentation. And then Ben and I will, actually we're going to probably open it up for questions at that point, and then we'll present the winners at the end. So that's, I guess, a little bit flipped around there, the last two things. So, about the Contouring Challenge, I mean, the first question that we needed to ask was, is accuracy important in contouring? And I think it's kind of obvious, but the main points that we like to talk about is that if your ROIs aren't accurate, first of all, your plan optimizations are going to be compromised because they're going to be optimized to the wrong volumes. Plan acceptance criteria could be wrong. You might have a doctor who's accepting a plan based on DVHs that he's seen, but if those DVHs aren't for the right volumes to begin with, you could be getting a plan that's approved on something that's not really there. And then, of course, if you're doing IGRT, that can also suffer because your IGRT setups are based on the ROIs that were drawn originally, and if those are in the wrong place, you're going to be setting up your IGRT incorrectly. So then we had to ask the question, can a quality system actually be put into place, and can it work? And so we had to ask, a few questions first. Is there actually a problem with ROI consistency today? Then we had to figure out, okay, if there is a difference or if you have variation in ROIs, are there any real clinical effects? Are there dosimetric issues, if the ROIs are not correct? And then we had to look at, well, okay, if those two things are in place, can you put a contouring quality system into place that the performance of that can actually be measured? So, is there a problem? This was fairly easy to answer. We used a bunch of data from the one of the ROR plan challenges, and just looking at just the volume variability. These are three of the volumes that were looked at: the right parotid, the left parotid, and the larynx. And you can see the distribution just of volume not necessarily were they in the right place or not, but just the volume themselves were completely different. And so the variability, question was answered pretty quickly. Dosimetric effects, are there issues when you have that? So if you have, a contour that is very close to what is considered to be the gold, as you see here, dosimetrically the DVHs are fine. But if you have something like this, where the doctor, was really expecting the ROI to be where you see this gold line here, and yet this is what the DVH looks like based on the ROI that someone else drew, they might approve this plan because this DVH looks good to them. But if this is truly the DVH, I don't think there's probably a doctor in the world that would have approved that plan. So there's definitely some dosimetric effects. So we've answered those first two questions. And then the question is, can you measure the performance? And this is where the standard imaging structured QA software comes into play. And just really quickly, I'm going to jump over to the software just to kind of show you how it works, because that'll help answer or show you kind of what these numbers that we're going to talk to you about here mean. So I've already preloaded a gold data set and my image set. So I'm going to load a secondary set, and this is actually from our first contouring challenge. What structure will do is it'll look at the two contouring sets and make sure that we have matches between the two for ROIs. So you can see we've got 5 matching ROIs here. I'm going to go ahead and load the data. And the first thing structure is going to do is it's going to basically bring us to the middle slice here. Do a little bit of window and leveling here to help see our images a little better. And it's going to give us kind of a qualitative look here of how the two, the gold and our contestant basically did. And as you can see here, we've got a bladder ROI, and the two match up quite well. The solid line that you see is the gold, the dotted line is our secondary. And I can move through my slices, but the real key to structure is when you hit the calculate button, because what structure is going to do is it's going to take those two contours, voxelize them into 3D space, and then determine how close that secondary one is to being equal to the gold. And any voxel that is outside, either it's missing or it's extra, it's then going to penalize it based on a distance. The further away it is, the higher the penalty. So all of your scores start at 100, and then as voxels get tested and determined for their distance away, those points get taken off from 100, and that will determine your score. So I'm going to click the calculate button here. We'll see it calculate the metrics fairly quickly. And there we go. And then you get your metric scores. And so as you can see for the bladder, which is a fairly easy ROI, you can see we got an excellent score, very close to 100. But as we go into the different ROIs, the scores start dropping down. Rectum at 52, prostate at 48, and as you can see here, they had, some extra voxels in here, some missing voxels, and we can even go over to our ROI difference regions and take a look and get an idea of how well these two match up. So as you can see here, if we look at the rectum down here, you can see where we've got some missing voxels here that were in the original gold set that the secondary set did not include. We have some red voxels here in the prostate that are extra in the secondary set that weren't in the original set. So that's basically how structure works. And based on that, let's go back here. So what we did is we took those that original set of data from the ROR plan challenge, and actually Ben took all this data and graphed the mean dose error and the max dose error against the actual structure score that people got when we ran it through the system. And so we're going to just kind of zoom into this area right here. And what we found is exactly what we were hoping to find, is that when you get to a certain point, around a score of around 75 or better, which is right around here, you can see that dosimetrically you're looking at only about a 10% difference in the mean dose error and the max dose error. So you can actually find a point where if somebody scores well enough using the structure method, you can actually tell them, hey, you're doing a good enough job. Anything below that, you start to see things spreading out quite a bit, and you can see mean dose errors and max dose errors reaching the 40% range.